Hi, my name is Charles H. Clyburn, and I am the host of The Art of Storytelling. I want to welcome you back to a very special segment this afternoon. This segment is dedicated to breast cancer awareness. Today we have three lovely ladies who are my guests. Talk about that. They have several things in common. One is that they are all breast cancer survivors. Our first guest is Mrs. Dolly Wallace. The second one is Mrs. Irene Moore. And our third guest is Ms. Julianne Cole. These ladies have much more in common than just being beautiful. They also are members of the same church, and they also are breast cancer survivors. So, enough of me. Let me have them tell you their story. Let me start out with Mrs. Moore. Mrs. Moore discovered you had breast cancer. How long ago was that?
19 years.
19 years. And so, did the doctor tell you this? How did this come about?
Well, they found the lump in my breast. And so when I went to the doctor, they weren't really sure. The surgeon told me they didn't think anything really was wrong, but just to make sure. So I went in to have the lump tested. And so when I was still in recovery room, he came in and that's when he told me that it was breast cancer. Because he only found out because of a mammogram. I didn't feel anything myself, but it was deep down in my breast. And when they did the testing, that's when they found out that it was breast cancer. I was really surprised, and so was my surgeon, because he thought that it wasn't anything to be worried about.
Can you describe your feelings at that point?
When somebody comes to you like that, and you're not even expecting it. So Brother Conrad, I was like, oh my. You know, when I was still in the recovery room, and I was waking up, and I saw the doctor walking towards me, I knew what he was going to say to me. And so from that point on, it's a different feeling that I don't know, unless you go through it. I mean, when the doctor tell you that, it's hard to explain.
My experience was a little different. I felt my lump the first time. I was 22 years ago. And I felt my lump for the first time. And I kept it to myself for about 3 days. And one night I woke my husband up at around 2 in the morning. Of course, he was waking up for sleep. He didn't know what I was talking about. And I said, what do I do? And he said, you need to go to the doctor. So I went to the doctor, had a mammogram, because the doctor couldn't see it. He felt it. So once I had the mammogram, it never showed up. The first time, the lump did not show up. And I went to the surgeon. He felt it, and then he did a biopsy. And determined that it was. The second time, 2 weeks later, when I went the radiologist picked it out. So I've had both experiences. One when I felt it and it showed. Next I didn't feel it and it showed.
So when you say you felt it, was that a self-examination?
Yes, it was a self-examination. And we never had any incident of cancer in my family. And the same year, I had cancer at a house.
So, Ms. Juliana, can you tell us the story of how you found out about this and how you felt at that moment?
My story starts a little earlier than my cancer was discovered. Prior to that, 2 years prior to me getting breast cancer, my doctors, the mammogram that had already showed that I had a gray area. And so I was not only having mammograms at that point, but every 6 months I also went back to have sinograms, which I think is at this point very important that when you have any form of cancer-related signals that you need to do checks more than just once a year now. And from those sinograms and me doing mammograms on an annual basis, 2 years later, when I did my annual mammogram, that's when calcification was discovered. Yeah, and I had to do a biopsy to find out that that was cancerous. So, and I have been cancer-free for 4 years.
Oh, okay. Did you do self-examinations?
I did self-examinations. There was no indication of it. I must say also that I feel very blessed because of my vigilance in doing mammograms and doing my annual as well as my monthly examination. My cancer was discovered very early. And I think that's something that we as women have to be very mindful of. Cancer, breast cancer is not a disease that you can say, you're doing something or not doing something to prevent. As a result, you must be vigilant about checking yourself, both monthly examinations as well as annual mammograms.
Okay.
When I had my first bout with breast cancer, I didn't have chemo because it was at the early stage, very early stage. When I had it 2 years later, it was still at the very early stage. However, the doctor recommended that I have mild chemo. But mild chemo, as far as I'm concerned, is just as bad as as just having the heavy dosage, because I did lose my hair, my spots in my hands and bottom of my feet, all the things that people, symptoms that occurred with others who had heavy dosage of the chemo. But as you can see, my hair is back and I'm just wonderful.
Yes, ma'am. Yes, ma'am.
Yes, and I went through chemo and radiation also. And as Sister Wallace said, it's a rough thing to go through. You know, you lose your hair. You think you're going to be prepared for it. You know, the doctor tells you, your oncologist said, okay, cut your hair short because to prepare yourself.
Yeah.
And so I did. And this one morning, I had one treatment. And this one morning I was in the shower, and my husband had left to go to the store, so I was there by myself. And I'm in the shower, and I'm going like this, and all of a sudden I have lumps of hair come out in your hand. And, but you know what? Once you get over the initial shock, it's like, okay, well, hair grows back.
That's true.
So, you know, you just kind of make it through. It is kind of rough going through it. I think things are a little bit easier on patients now when they go through. But I know my very first treatment, I just thought, oh my goodness, am I going to make it through this treatment? And my husband kept telling me, you know, you should call your oncologist, see if everything is all right. And I went, no, because nobody in my family had cancer either. So I'm the first one to go through. I only know what I see, what's going on TV. And so I was very sick. Of course, when I went back to see my doctor, I should have called, like my husband said. And he says they needed to adjust it. It was kind of strong for me. But the best part about it, if you go through it and then you have an end date, you know when your last treatment is going to be, and you just work towards that.
Like Sister Irene, I'm also the first person in my family to have had breast cancer. And it's something that you are not fully prepared for in advance, and I'm very happy that, you know, there are so many programs out now for you to listen to and hear other people's stories like ours today, because sometimes you think it's going to be the end of the world, but there are a lot out there, there are a lot of support, and you can always find things to be able to help you. I did want to bring a point out, and that is the importance of having yourself a team when you are going through breast cancer. Both a medical team and a support team. It's very important, and I'm sure these ladies can attest to that, that this is an important part of going through breast cancer. Your medical team is one that you have to make sure you spend time gathering the group that you want to take care of you. It's important because not only do you want to understand what you are going to face, but you also want to be able to have them understand who you are and what you're able to, what you're capable of facing. And I think you all can attest to the same thing through your other experiences.
I must say, I was 42 when I had my first bout. And breast cancer certainly changed my life for the better, because I know that I'm more compassionate. I focus a lot on the men who have to be servants at that time to their wives. I think about how men internalize. So I make it a point when I know that their spouse or significant other is going through breast cancer, I would ease up to them and tell them some things that I went through so that they will sort of get an idea on how they can assist their mates.
Sister Juliana, did you have any symptoms? How were you diagnosed?
None whatsoever, other than the fact that my prior two mammograms had gray areas. I had no symptoms. I did not feel tired. Some people sometimes say they feel tired. I did not. I did not have anything to recognize that I was going to have be diagnosed of breast cancer. And by the time I, got the results, it was not shocking altogether because I had those two gray areas, and the fact that I'm going through sinograms also. There was, to me, something that the doctor had been seeing that led up to that they finally said it had happened. But so the shock wasn't there for me. But at the same time, I just felt good that I had not let it go, because we have the tendency sometimes when the doctor tells us some things, we say, oh, it's just nothing, and I will take care of it tomorrow. So we tend to think about that, wanting to take care of it tomorrow, and just doing that. I mean, I did have, to my story, I did have one point where when they first sent me that notice from my doctor to say, it's time for you to go and have your mammogram, that I did delay. I did not go right away. Maybe about a few weeks had gone by, but I had such a good doctor. They sent me another notice. We have not seen anything, so please go into your mammogram. And once I did, I found out what it was, and it was a good thing that it happened then. Something that Sister Wallace said that resonated with me also is that, I think anyone who comes through breast cancer should see something different about themselves. And it makes you a different person. I'm not saying you want to go through breast cancer to be a different person, but once you do go through it, it does make you a different person. Yes, it does make you a different person.
Sister Irene, you heard Dolly talk about how things changed in her life, and Sister Juliana said, would you agree with that?
Oh yes. You have a completely different take on life. You come out more compassionate. You're more concerned about everybody. And especially when someone is going through. Yes. You just give you a completely different outlook as to how you treat people and what's more important in life.
Right.
You really come out feeling different, because it just puts you in a different mindset when you're going through. When you're going through and you're going in, because I had to go through chemotherapy,
Yes.
and I go through, and you go in for your treatments, and you see all these different other patients that are going in, and you see the different stages they're going through and what
Yes.
you're going through, and you just come out, just thanking the Lord and being real happy
That's
about
true.
that you've made it through.
I must share something. Out of 7 children, all 3 of my siblings have died from some form of cancer. My brother prostrate, my other brother lung, and my sister breast cancer. I changed oncologist this year, and she was looking over my history, and she said, I'm going to give you what is called the BRCA1 and BRCA2 gene test. And she said, because you've lost siblings and you might be carrying that gene. So she gave, and it's just a simple blood test. And she gave me the test, and I do carry the gene. So from that information, she recommended that I see gynecologists, oncologists, and I've seen that doctor. So I'm scheduled in June to have my ovaries removed, because since I carry the gene,
Yeah.
I'm at high risk of having ovarian cancer. So also with that information, I email all my family members to let them know so they can get checked. And especially my nieces and my nephews and my children and my sister. And for men, if you carry the gene, you're at high risk for prostate cancer. So that means you go into that doctor and you let him keep an eye on what's going on with your body. And from that, I've learned how I have to take control of my own medical treatments and stay abreast as to what's going on with my body. But from the BRCA test, she also did what was called the CA-125 test to test me to see if I have ovarian cancer, and I don't.
No, praise the Lord. So, Sister Julianne, what I'm hearing, and maybe the audience is a little confused about this, is that breast cancer or cancer period is hereditary?
Not necessarily. It's not. It's not hereditary.
Okay.
But if you have, like Sister Wallace is saying, if you have that BRCA1 or 2 gene in your family, then the possibility that more than one person or several people in the family may get breast cancer or some other form of cancer. But it's good to check for that gene, because if you have had breast cancer, it's good to check to make sure that you can help to save other lives. So that's one of the things that's important. Or the possibility of you recurring in your cancer, because you can also get breast cancer more than once. We know there are a lot of people out there who get breast cancer 2, 3 times in their lifetime. Yes.
Miss Irene, you mentioned male support, and Sister Dollar did too, but how do you, in trying to get your husband to understand what it was that was happening to your body, how do you get that across, and how do you explain to him what is going to change in your life?
Okay, it was very easy with my husband, Carl.
Okay.
Because he went through this from day one with me and with talking. As a matter of fact, when the doctor came out and told him that I had breast cancer, and he came into the room and he said to me, "It's going to be all right. I just have this feeling that you're going to be just fine." And he was with me the whole time. As a matter of fact, he was just so supportive. And he kept records of stuff. He wrote things down. He would take a little tape recorder to the doctor's office and record, because he said, I'm not going to remember everything that he said, and neither will you. And so he would record. He'd put the dates on it when I went to the doctor's, what doctor I was going to. And then when certain things would happen to me, he would, wait a minute, he would go listen to a tape, because the doctor would tell you, certain things might happen, what to be expected, because we hadn't been around anyone that had cancer or anything, and so he kept the little tapes, and got a little tape recorder, and he recorded things, and he would listen to what the doctor would say if I had certain pains or certain things that happened to me. Okay, that was expected, and and so that's how I went. And even some of his friends would talk with him and say, okay, you're going through this with Irene, but how are you doing?
Yes.
And they would want to talk to see how he was doing.
Surely.
Yeah.
Surely.
Well, we were new to the area when I had my first bout, and when it was only the two of us and my two kids, so my husband had to take over when I could not do for the family. So, but I can remember clearly when I came through the surgery, I asked the doctor, I said, did you tell him yet? And he said, yes. I said, well, how's he doing? He said, well, he ran out to the library, because you didn't have access to the computers, because he wanted to read up and be able to discuss with me what type treatment that we would have. And he went with me every step of the way to the doctors. I remember there were times when I would have the treatment and I couldn't eat. And he would say, well, you like seafood, so we're going to go and get some food. And once I sit down and look at it, I still couldn't eat. So he would tell the waitress to just pack it up, and then he would warm it up for me when we got home. So when I had 6 treatments, when I got to the 5th treatment, because with me and my body, the chemo built up in my body, and it got worse and worse and worse for every treatment. So when I got to the next to the last treatment, I said, I can't go anymore. That's it. And he said, well, that treatment might be the treatment to save you. He said, so I'll buy you, if you take that last treatment, I'll buy you whatever you want. I'll take you on a cruise. You said you always wanted to go to Greece. Tell me what you want to do. So I was looking at TV one evening, and I saw them advertising some mink coats. So I said to him, I want a mink coat and matching hat. And he said, take the last treatment and it's yours. So that's why when you see me come up in church with my mink coat on, that's what I got for taking my last treatment.
Yes, ma'am. Yes, ma'am. You wouldn't recommend somebody getting breast cancer just
No.
Okay. That's very interesting. Sister Irene, I wanted to, just because we're talking about things that most women are aware of, we certainly want to talk to the male audience about certain things. For instance, do males get, I know I haven't, ever had a routine mammogram? Does that happen usually?
Not that I know of. I don't think that I know of anyone that has a male having a regular.
Okay.
They do get breast cancer,
Yes.
But I don't know of anyone that, or even have anything set up where they would have it done, annually.
I see.
I had a brother, my brother-in-law, as a matter of fact, had breast cancer.
I see.
And I think he was in like his 20s when he had it, but it's been like 30-some years or so since, so he's a survivor of maybe about 30 years.
I was reading an article in WebMD magazine that said that the new cases of breast cancer in the United States in 2011 amongst females was almost 227,000. Males were diagnosed in that year at a little under 2,200. So there's a vast difference, obviously.
Yes.
But it's important for us to know and to understand that, in fact, males can have breast cancer.
Right.
Definitely.
Yes.
Okay. All right. I just want to make that sure. And your brother-in-law is a survivor of how many years?
Probably about 30 years.
30 years. Okay.
At least 30, yes.
All right. I also noticed in that article that the average age when diagnosed was 61 years.
Oh, really?
Yes. Now, that's across the country, of course. But obviously yours was sooner than that. And obviously all of you, because you're not 61 yet, of course. So of course that's an average, okay?
Yes.
But I do want to talk a little bit about breast cancer awareness.
Okay.
There's a month, and I believe it's October,
Yes,
that
it
is
is.
designated as breast cancer awareness. And the color pink is one that is the color of that effort.
Right.
I see Sister Juliana has her pink pin on, and Sister Dolly is accessorized in pink. And so that is something that we want to put out there in terms of being aware of breast cancer, especially in men. I think that most of us don't want to think about that.
Right.
It's a women's disease. We don't want to be concerned about that. Mammograms, we don't have those. We don't get diagnosed, or we don't go see about that because women do that. Okay, but the article goes on to say the percentage of women possibly diagnosed in life is 1 out of 8 women. The percentage of men possibly diagnosed is 1 in 1,000. So there's a small percentage based on male, female, but the fact of the matter that it's a real situation for males.
Yes.
In preparing for this program, I talked to a number of people and tried to talk to somebody about finding a male cancer survivor, and no one could identify one. I'm sure there are some,
Yeah.
and I hadn't talked to you about that, but obviously there are some, but none that could be identified. And the other thing was some males don't want to talk about it.
Exactly.
Because it's a female disease, it makes you less manly, I suppose. I don't know, not having been put in that situation. Juliana?
Well, I wanted to say also that, you talked about the fact that women, we have our annual mammograms, and that helps to discover this disease when it shows up. And the fact that men do not go through an annual mammogram, I want to think that most of the time, by the time they are diagnosed, they're in a higher stage of cancer because of no diagnosis, early. So I will encourage men that do self-examinations, because if you think that you're feeling something in your body that's foreign, it's good to go and get it checked out. So even though you are not doing a mammogram on an annual basis, you can do self-examination, and from self-examination, you'll be able to alert your doctor of what you need done.
I don't intend to speak for the male population of the world, but I can say this, that generally men don't want to, first of all, think about that,
Yes.
because it is a female disease. Secondly, if they find out that there is something, they don't want to go to the doctor.
Right.
And thirdly, if it happens, they certainly don't want to talk about it to anybody. I'm not sure that there's many men who discover they have a lump in their breast and went to the doctor, even did a biopsy, would do that publicly. And excuse me a minute, I'm sorry for the interruption. Can we edit this, please? Thank you. Sorry about that.
I almost talked about it before we got started.
Okay. Okay. So a number of men, don't even want to talk about that to anybody.
Right.
But we do need to raise the awareness of males.
Yes.
Yes.
That is a disease, and certainly they can have this, and certainly need to be aware and do something about it.
Definitely.
Because I think Sister Juliana said something about early awareness and early diagnosis.
Yes.
Is that? Would you agree to that?
Yes.
Yes.
Oh, yes.
Okay, so that is helpful in terms of knowing early on and treating it
Yes.
early on.
Oh, yes. Oh, yes.
Someone once of you said, I can't remember, it said 2 years went past, or
Yes, I had the gray area for 2 years,
Right.
and so my doctor had said, my gynecologist had said that I had to go every 6 months for it to get it checked rather
Right.
than every once a year.
Right.
And as a result of that, when the discovery came about, it was good, because had I waited another 6 months, my stage of cancer would have been much higher had I waited. But I was able to get my diagnosis at stage 0. As a
Right.
result of that, like my colleagues here, I did not have to go through chemotherapy. So
Right.
early detection is very, very important
right?
to breast cancer.
Okay. Well, one of the interesting things that I read about the National Cancer Institute says that prevention and risk can be reduced when things like 30 to 60 minutes of moderate exercise,
Yes.
such as brisk walking, of course, control of diet and weight control, can also prevent
Yes.
a resurgence of the symptoms.
Right.
I'm sure all of you heard that
Right.
from your doctors. It's just one of the interesting things that I found out. One of the things that we want to wrap this program up with is, what would you say to young women, and maybe not just young women, but women out there, starting with you, Sister Dolly, about what they should do and how they should take this seriously?
I'm glad you asked that question. I was just thinking about the young ladies who are out there who need to learn how to do a self-examination and to make sure that they do it monthly. And we as women tend to take care of everybody else besides ourselves. So we need to start thinking about our health, because we cannot take care of our families if we don't keep ourselves healthy.
Yes. Sister Irene,
Yes.
you have something to add to that?
Well, I agree with Sister Wallace, and just be vigilant with doing your monthly exam, making sure that you do it at the same time every month. And like Dolly said, we can't take care of our family if we don't take care of ourselves.
Exactly.
And women as a whole, that's what we do. We worry about taking care of everybody else but ourselves.
Yes. Sister Juliana?
If you are not certain about how to do a self-examination, I'm suggesting that you actually find a professional to help you and show you how to do a self-examination. And I can't overemphasize, the point that it's important. It's very important to do a self-examination monthly.
Yes.
It's not something you take for granted. It's not something you find yourself too busy to do. It's not a thing that you need a lot of time to do. While you're doing a shower, you can do a self-examination. So find someone who knows how to do a self-examination and let them teach you how to. So it's very important, both for young and older women. There are some women who don't do self-examinations for a long time in their lives, and it's important, whether you're young or old, to do one.
Ladies, thank you very much.
Thank you.
I
you.
hope that the audience has been educated.
Yes.
I hope that they understand the significance of breast cancer, both in males and females.
Yes.
Thank you for coming on this show and sharing your experiences and sharing your knowledge with the people and our listening and audience. I want to say to you that you've learned a lot about breast cancer today. I hope that you will take heed. These women have brought to you a way in which you should take a look at how you look at yourself and consult your doctor. But I want to say to you that these three women are three of the bravest people I've ever met. And I know them personally, because to come on this show and to tell their story is not only brave about themselves, but it's also wanting to share their experiences so that you can avoid perhaps a situation that they've encountered. Ladies, thank you very much.
Thank you for
Thank
having
you
us.
very much.
Thank you for
You've
having us.
enlightened us, and really appreciate your being here. So, for the art of storytelling, my name is Charles H. Clyburn, and we'll see you next time.